Hello, everybody. I'm delighted to be here. So, I have more of a direction now since the last segment we did when everybody told me, most of you told me about the issues you were most interested in hearing about. So, I created a list. So, every day we are meeting, that is January 19th, 26th, February 2nd, February 9th, and February 16th. We will talk about different topics that came up when you spoke to me last week. So today I thought I could talk about sexual pain because it is really hard to really think about pleasure when you're experiencing pain. So today we'll be talking about sexual pain, lubes, moisturizers, dilators, all the thing you can do to make your body better so you don't experience pain. Um, on the 26th, the next week, we will be talking about sexual desire and what are some of the things that help with desire, how to really kind of help ourselves experience desire because desire is all in your brain. So that's what I'm going to be speaking about. And February 2nd, we're going to talk about how to talk to healthcare providers about sex, because that is a very important thing you need to learn about how to speak to healthcare providers about sex so you get the right information. And February 9th, we're going to talk about how to communicate with your partners, relationship partners and dating partners about your body, what you're experiencing, about your sexual ability, what works, what doesn't work. And February 16th, we will be talking about dating, single and dating. Okay, so I think I've covered a lot of things. And if there's anything I didn't cover, we can cover it anywhere. We can talk about it at any time. So there are a couple of things I want to tell you about sexual pain. One of the first things I want to tell you is it is not uncommon because yes, if you miss a session, I think everything is being recorded, so you will be able to get the recording. Yes. So one thing you need to know about sexual pain is that because of the treatment, our bodies change a lot. And what happens is the body, especially, hormone-based breast cancer or ovarian cancer, one of the treatments is to deprive the body of estrogen and progesterone. And when that happens, your vaginal walls become very fragile and dry. And so any sort of activity can be painful. So this is the fact. You have to remember that. And chemo can also cause vaginal dryness. So these are side effects of your treatment. So knowing that, you have to remember that it's never normal to bleed. It's never normal to experience severe pain and bleed. So most importantly, you have to manage the expectations of yourself and your partner. You should not have intercourse when you're experiencing severe pain and when you're bleeding, because the more pain you experience, the more you will not want to engage in this activity. So you're going to start losing desire. That is not a good thing. So I'm giving you permission now to very gently tell your partner that your body is not ready for sexual intercourse. Because soon after you've had treatments, your body is not ready to have the penetrative sex that you had before because of lack of estrogen, lack of testosterone and progesterone, and the dryness your body is experiencing. Your vagina, vulva, there's so much dryness. And the dryness, what happens when you're dry is you feel itchy And, even external stimulation of the genitalia of the vulva may not feel comfortable. So it's really important to tell your partner, can, lead the way. Do not passively say, okay, I'm just going to lie there and I'm going to just put up with the pain because I want to make my partner happy, because that is not going to help you in the long run. And so this is where what I always talk about, which is broadening the interpretation of sex, is really important, because you really need to, you know, kind of explore other ways to be sexual so you can protect your body during a time when your body is healing. Okay? So, what are some of the things that can be helpful? Some of the things that can be helpful are, moisturizers that do not have parabens and all the toxic stuff. So you have to be careful about what lubricants and moisturizers you buy. And we talked about some of the brands like Good Clean Love is good, Uber Lube, and Rivera is good. So there are some brands that are meant for cancer survivors and do not have some of the toxic elements. So you need to really find those. In my resource list, I have names of some of these lubes. I also have places where you can buy them from. So, I think it's sexualityresources.com. That organization has an entire section on products for cancer survivors, like all cancer survivors. So you can go there, look through it, and you can even get samples of some of the moisturizers and some of the lubes and see if you can use it. Now, one person had asked me, what about estrogen and progesterone positive cancers? How do we manage it? Can we use estrogen? So that is not a question I can answer without carefully paying attention to what kind of cancer you have. Because, yes, estrogen can help our bodies tremendously, but for some of us, it also has fed our cancers. So we cannot take systemic estrogen. Systemic estrogen is taking it in a pill form or injection or something that goes all over your body. So most of us cannot do it. If we have ERPR positive cancer, so you really have to be careful. You need to talk to your oncologist about it. And at some point, people who have been through cancer and have recovered, and or people who do not have ERPR cancer may be able to use topical estrogen. They may be able to use estrogen just in the vaginal area and the vulva. So that again, you need to check with the oncologist. That's not a question I could answer, because that would be irresponsible of me to answer a question like that, because I don't know where you are in your cancer journey and what is your kind of cancer, because this is something that has to be decided by an oncologist. Okay. So, having said that, I would like you to ask the question, ask the oncologist, I know that this is my cancer, but can I use topical estrogen? Can I use estrogen in the vulva and the vaginal area because I'm experiencing a lot of pain? And so you should be asking them these questions. So on the 9th, on the 2nd, when we're going to be talking about how to talk to healthcare providers about sex, we can do a role play. How do you bring it up with your physicians, with your healthcare providers, and say, this is, very important to me. So I need your, opinion. Can I use topical estrogen? Would it affect my cancer prognosis? So I would certainly do that. So I would use these lubes and the moisturizers. Moisturizer is like moisturizing your face. After you take a shower, you moisturize your face. The same way you will moisturize your vaginal area and your vulva. So what is the, people are always confused. What is vagina? What is vulva? They are confused about it. So, the birth canal, that is the area where the penis goes in, or if you use a dilator where the dilator goes in, that is the vagina. That is a vaginal canal. And that's what dries up, and that's what makes intercourse painful. So when you use a moisturizer, you can use an applicator and moisturize the inside of your vagina. And you could also apply some on your vulva. Vulva is what's outside, the external lips, that's vulva. You could apply it on the vulva as well. So that could be, very helpful in addressing your dryness. So when you are ready for penetrative sex, we will talk more about how to also prepare for it now. When you're ready for penetrative sex, then you'll use a lubricant. So you'll use a moisturizer to moisturize your body, but lubricant is used when you're having a penetrative sexual experience. Can I recommend a specific moisturizer? There are so many choices. And a moisturizer would be, Good Clean Love has moisturizers that's very good. Uber Lube has moisturizers that's good. And Revere, I mean, Bonafide is good. So find the one that works for you, because even though I am saying it's good, you have to see whether it works for you, because you have to get a sample from the company and try it on and see if it really works. So the information would be in the handout that is available. And Rachel, you can you put the link to that handout that I prepared for the group? I'll see if you can get it, or I'll have make sure that it's emailed to you. Okay. Somebody wants to know about condoms. Okay, somebody's talking about the use of Revere by Bonafide, and you know, stop my mic stopped working, but I can share the handout after this class. Okay, they can. So Rachel can share the mic after the share the um, handout after the class. So, so how do you prepare for intercourse? It is not. You have to forget about how your body worked before cancer. It is going to be different. So you have to embrace the difference and not think, why is my body changing? I'll never be able to do this. You will be able to do all the things you did before, but it just takes a little bit of time, patience, and a different way of looking at things. So another very important product that can be useful for you in the journey to having penetrative sex is graded dilators. Graded dilators basically are what look like the penis in different sizes. And they are sometimes, there are so many different kinds, but the ones I recommend, yeah, here, it's a lovely one. Great. Thank you so much. A full set of dilators. So this is a great. Thank you so much. So the vaginal dilators are a good way to really kind of get used to having something in your vaginal area, because you're taking a break and your body is changing. So start from the smallest dilator and work your way up. Before you actually have sexual intercourse with your partner, you need to try the dilators first, because you're working on it. You can control it, because this is not a good time to try to have intercourse with your partner when your body is not what it used to be. So you need to wait. You need to try the graded dilators first and then try penetrative sex with your partner. How often should we use vaginal estrogen and moisturizer both in vagina? Again, the vaginal estrogen, I'm going to not answer that question about vaginal estrogen because that should be for your oncologist to answer because it totally depends on what your kind of cancer is. And as a person who is not a trained medical professional, I'm not going to answer that question. But the moisturizer you can use every day in your vaginal area and around, you can use it every day. And you may say, "Oh, only going to use it when I have some sexual activity." You can have sexual activity with yourself. So you can use the moisturizer pretty much every day. Okay? Graded dilators. I've been using Bonafide for a few months. They make a regular extra strength version. The one thing I've noted is they're not condom compatible. The moisturizers that are not, the lubricants and moisturizers that are not condom compatible are the latex versions of them. So if the moisturizer or the so moisturizers are usually not silicone based, but if the lubricants are silicone-based lubricants, which are actually much stronger than the water-based ones, but they are not compatible with condoms. So you have to use water-based lubricants. So there are different kinds of lubricants, okay? Water-based lubricant is the best version. Sometimes it doesn't last because it's thin and it kind of wears out. So sometimes people use water-based lubricant and then they use the silicone-based lubricant on top of it to seal it because then it is extra strength. It lasts a little bit longer. The one thing I would advise you never to use is oil-based lubricant. And please do not use coconut oil or any other oil because A, they have impurities. Secondly, they can also trap bacteria. So no oil-based lubricants should be used. And also, very, very important, do not buy lubricants or moisturizers that say it's warming, cooling, tingling. You don't need any of that stuff because those things can really be very irritating to your very sensitive vaginal tissues. So do not buy anything that claims to provide arousal. You do not need arousal cream. Your arousal can come from your brain. We're going to talk about it next week. So please do not buy things that have products that will give you arousal. You don't need it. It can really hurt you. So there's one question here. I don't mean to sound dumb, but I'm going to ask anyway. None of the questions are dumb questions. Please ask away. When using a dilator for the first time, you would use lube. Yes, you would definitely use lube. Anything that goes in your vagina, you need to use lube. When our doctors examine us, when we are at a gynecologist's office, when they're examining us, they're using lube, by the way. And do you need to do anything in particular? Hey, if you can fantasize and masturbate during the use of a dilator, by all means, do it because it will just make it more pleasant than just putting a dilator in and sitting there doing nothing. Just insert it. Yes, absolutely. How often should we be doing this to train to get back in the saddle? As often as you can, as often as you can. And I always say when you're doing something like this, putting a dilator in your vagina and you're lying in bed, I would suggest don't read the news, don't watch the news because there's nothing exciting in the news. And you may feel traumatized. So I would say read erotica, read some erotica, have some, or watch a show that is exciting to you. Or so when you are training your vaginal walls to get back in the saddle, you can also train your mind at the same time. You can fantasize and experience some pleasure so you can make it work in more than one way. Okay? I love that question. Thank you so much. Every time people say, "Oh, I have, I have a dumb question," I always think it's going to be an interesting question. Okay, that must be so. What is that? Exactly. So many of these products that are not compatible in the fine print. So please read carefully if you have this concern. Yes, you do have to read carefully the fine print and know that some of these are not compatible with condoms, but that doesn't mean that you should not use it for masturbating for other purposes. So many of these products have not been okay. Dating with this concern, yes, yes, it is something that you may need to keep in mind when you're dating because you're more likely to use a condom and you want the condom to work. So yes, I haven't had penetrative sex with my partner since treatment started, so it hasn't been an issue for us. But based on what I've read, you can sort of time your moisturizer use and avoid using it day, evening, so you can have sex. Yes. And we are all individuals, so we all can, manage it carefully. What works for us, what doesn't work for us. Even the moisturizer lubricants, what works for me may not work for you. So figure out, what works, and if it's irritating, then stop using it. And find another option. There are many options, so you can find a different option. So, very unfortunately, I'm at the end of our meeting. I hope whatever I told you is useful. Please put things in the chat. I read everything because I want to be responsive to your concerns, and I would like to answer your questions uh, as well as I can. So, next week, we are going to be talking about desire. I hope all of you will show up. And one of the things I want you all to do, I want you all to come to the class and tell me what is your favorite fantasy, because we're going to be talking about fantasies. Okay? So until next time, I will see you next week. I want you to remember everything I told you, and we will have a final discussion about everything on February 16th when I finish this segment. Okay? Talk to you later. It's not, is it normal to experience burning during urination after intercourse? No, you should talk to your urologist about it because it could be a UTI. Okay? Okay. Take care, everybody.